Hi, everyone. My name is Esther. Thank you for the lovely introduction. So yes, I am a physiotherapist here at KK Women's and Children's Hospital. But before I start to talk about exercise, I just wanted to give a quick introduction about myself. I've been a physiotherapist for quite a while, and then since returning from the States, I was given a wonderful opportunity to be a women's health physiotherapist here at KK. And since then, I really fell in love with this topic, and really I wish to do more to educate mummies about how to take care of yourself, especially during pregnancy and after pregnancy. Okay, so let's begin. So I understand that most of you are pregnant for the first time, and you may have already delivered, or you're still, pregnant. But I would like to talk to you about how to exercise during these two periods, because it can be quite confusing. You're going through a lot of bodily changes, and you're not really sure what to make sense of all these new, everything that is new. So I'm just going to briefly talk to you about the benefits of exercise and how to exercise throughout pregnancy and after childbirth. Aside from exercising to improve overall health and weight control, I will also talk about some targeted exercise for the pelvic floor, because as a women's health therapist, I can't help talk about pelvic floor. I think that's one of the areas that we need to highlight it to a lot of pregnant women and postpartum women, because a lot of us experience urinary leaking during this period of time. Okay. So according to the Perinatal Society of Singapore, guidelines on physical activity and exercise in pregnancy, this was published last year. In a local study, unfortunately, about 23.9% of Singaporean pregnant women are overweight, and 10.8% are obese. So gaining too much weight during pregnancy increases the risk of cesarean delivery, postpartum weight retention, and having a high birth weight baby. So during pregnancy, exercise promotes healthy weight gain, reduces mother and child complications related to gestational diabetes, and it enhances maternal health, mental health. Because when you exercise, your body actually produces happy hormones such as endorphins. So that can actually break the monotony of how you're feeling at that time. So this actually applies to after pregnancy. So aside from kind of getting your body back after pregnancy and a healthy weight loss, you should also think about exercise as something for your mental health as well. So now that we know that exercise is important, does anyone know the recommended amount? I think previously it was probably shown in a video, but I'm just going to talk about it in detail. So the magic number is, again, from the published guidelines by the Perinatal Society. If you were to walk away with any number, 150 minutes of moderate intensity physical activity per week should be your target. If not, a minimum of 20 to 30 minutes of physical activity per day, at a minimum of 3 times per week. So the takeaway here is, when you exercise, if you want to hit your target, you should think about the duration of your exercise, the intensity of your exercise, as well as the frequency. So duration would be per session, how many minutes are you going to exercise? And then at what intensity? Moderate intensity, would be the recommended intensity, which I'll talk more. And then you can think about the frequency. So usually if you have not exercised before, we recommend starting at 3 times per week, okay? All right, so how hard should I work out? There are many ways to tell how hard you should be working out. There are very complex methods, but I thought the most straightforward method would be a talk test. So you don't want your exercise to be too easy, neither do we want it to be too hard. We want it to be just nice. So if you can sing to the person you're exercising with, or your imaginary person that you're exercising with, then it's too easy. But if you can still talk while you're exercising, it means that likely you are exercising at a moderate intensity exercise, right? And that's what we want. However, if your exercising is really too hard, you can't even speak to the person next to you, means it's a little bit too vigorous, right? Now, the other way that you can think about it is, how do you feel, your rate of perceived exertion? So you want it to be between 12 to a 14. But let's say if you were to memorize anything, just remember that you should be exercising based on the little scale at the bottom. It should be at somewhat hard. So it should be at a 13. Okay, so if you rate yourself, you feel like you're rating yourself at a somewhat hard, means that, okay, you're actually exercising at the correct intensity, right? Okay, there are other methods in determining how to exercise. Okay, so based on this table, right, if you look at the left-hand column, based on your maternal age, right, say most of you are between 20 to 29, maybe 30 to 39. And then based on your fitness level, you can look to the third column to decide your heart rate range. If you have a smart watch, you know, you can easily open up the heart rate tracker, and then you can see how hard are you working based on the numbers on your watch. Okay, like I said, if you've never exercised before and you're really thinking about starting, just start somewhere and begin 3 times per week, progress to 4 times per week, and accumulate again up to 150 minutes of moderate intensity physical activity per week. Now, to prevent injuries, okay, you don't want to skimp the warm up and the cool down. So warming up is a great way to prime your muscles and your heart for a workout. So a warm up could be like walking even, okay? Cooling down will allow your heart rate to slow down gradually, so you don't want to start and stop suddenly, basically. And finally, you can stretch after you're cooling down. This can help reduce muscle soreness. So there are recommended activities. Okay, so there are different types. So aerobic exercises are more for your cardiovascular health, more for your heart health, and to improve your endurance. So things like brisk walking, swimming, stationary cycle, low impact aerobics, jogging, and or modified Pilates and yoga. Now, resistance training could also be aerobic training, but resistance training, think about it as you want to improve a target set of muscles to strengthen yourself, okay? So things like squats, lunges, push-ups, light dumbbells or weights, and using resistance bands are resistive type of exercises. So when you think about starting a exercise program, you can mix the two together, okay? Just so you can make it relevant to yourself and make it fun. All right, if some of you are worried about, say, you know, you're not looking good at a certain area, like say your arms, you know, you can think about like during pregnancy or after, you can think about toning your arms with certain specific type of exercise. Okay, so if let's say you started exercising, you feel pretty good about it, we recommend that the best time to progress your exercise is during the 2nd trimester. So again, you want to gradually increase the frequency, the duration, right? And then the intensity. Okay, now, your doctor may not go through this with you, or even if you sign up for a exercise class, they may not go through, sit down and go through this with you. Some classes, some providers will. But let's say we talk about some safety precautions, right? Okay, so if you're exercising, you want to avoid physical activity in excessive heat. You don't want to overheat, and avoid exercises that involve physical contact or danger of falling. So things like ice skating or touch rugby, those would be a big no-no. Definitely avoid scuba diving, okay? And then when you're exercising, maintain adequate hydration and nutrition. Make sure you drink water before, during, and after physical activity, okay? Now, for some of you, maybe you are pretty athletic before all of this and you're considering competition or exercising at a significantly higher rate than the recommended guidelines. We think that you should seek supervision from an obstetric care provider. Okay, so a couple of red flags, reasons to stop physical activity and consult a healthcare provider. If you have any persistent shortness of breath, okay, loss of fluid from the vagina, that could indicate that the water bag has broken. Okay, those if you feel that there's a persistent leaking of fluid from the vagina, you should stop right away. Also, if you're exercise and then you feel dizzy and or faint, and the feeling doesn't go away, all right, you should also stop. Now, if you experience severe chest pain, regular and painful uterine contractions, any vaginal bleeding, those are signs that you should contact your healthcare provider and stop what you're doing. Okay, so just keep all these little things in the back of your head so that you know that when you're exercising, are you in the safe zone? Are you not in the safe zone? So you won't feel like exercise is such a scary thing. Okay, now to break it down and make it easier for some of you is when we talk about pregnancy, we talk about trimesters, right? So I thought it would be helpful to break it down to each trimester. So even though this is your first pregnancy, if you've already passed your first trimester, for your subsequent babies, you can keep these in mind. So during the first trimester, a lot of women experience morning sickness. So it is best not to exercise in a very hot environment because you don't want to overheat. Your risk of hydration is higher because of poor fluid intake and vomiting due to morning sickness. So make sure you drink plenty of water. And you may not even feel like exercising during your first trimester because you don't feel so well. Now, during the second trimester, your energy level picks up. You may not feel as nauseous anymore. You can try to start exercising at this time. And like I said, if you want to progress with the level of intensity and difficulty, you can experiment during this period of time. So in the second trimester, you'll start noticing bodily changes where your breasts and your womb start to feel heavier. So make sure you wear supportive bras and avoid activities lying on your back for a long time. When your womb gets really big, after about 16 weeks, you may feel quite uncomfortable to lie flat on your back. And that's because the weight of your belly is potentially pressing down onto a large vessel that is pumping blood back to your heart. Okay, and also if you lie flat on your tummy, on your back, your tummy actually kind of like rides up against your lungs, so it's also difficult to take a deep breath in. So some of you may feel breathless if you exercise lying on your back. Okay, so try to avoid doing that. You can try side lying, you can do standing. Okay, if you're not sure, you can always ask if you're attending a class, you can ask the instructor. Okay, now during the third trimester, okay, the womb is growing a lot faster, and then you may experience more bodily aches and pain. Just be kind to yourself and expect to slow down and be prepared to reduce your exercise intensity as you may feel more uncomfortable. Okay, all right. Now, I know I've been talking a lot about just exercising during pregnancy. But these are some considerations of how to exercise after giving birth. So women in general can start exercising immediately after if they have an uncomplicated pregnancy and or delivery, okay? But if you had a C-section or things like assisted delivery or a more complicated tear, it's best to consult your doctor and wait 6 to 8 weeks before you start regular exercise, excuse me. Okay, now don't be surprised that you may experience new aches and pains in your body due to the many new tasks that you will take on as a new mother. So for example, like if you carry baby for frequently, you may experience some tendonitis type of pain in your arm and maybe your shoulder. And this is obviously because of overuse, but doesn't mean that you have given birth, means that the hormones in your body have returned back to its original state. So the hormones in your body that were produced during pregnancy can persist up to 3 to 5, maybe even 6 months after. And that ligamentous laxity that you experience when you're pregnant can also cause some back pain, or can contribute to, not cause, can contribute to. Okay, all right. Now, another thing that I wanted all of you to consider, if you might also want to check with your doctor if you have a separation of your abdominal muscles, and to ensure that it's healed before you commence exercise. So having a diastasis recti simply means like if you look at the two pictures, the one on the left would be normal, and the one on the right means a separation. So maybe if you get up from bed, you see your tummy doming, or you experience like weakness, especially you have difficulty getting out of bed because you need to use your core muscles. You're not really sure how to tell if you have a diastasis recti. It's just best to seek help from your doctor. okay? Because this is something as easy to like highlight, and then you can seek treatment if needed, so that you can learn how to strengthen your core and modify your exercises so that you don't make this any worse, okay? But for this, usually if most women who have given birth will find that the line in the middle is the gap in the middle is slightly wider, but we just don't want it to be too wide, okay? And give or take about 6 months, it will start to come together. But for some people, it is persistent. That's why I thought it would be good to mention, okay? All right, now the other thing, I realized I didn't add, but it's okay. So I wanted to talk a lot about talk more about exercise and breastfeeding, because having been a mom before, things that are top of mind after you give birth, the number one thing is breastfeeding, okay? So according to the La Leche League International, research shows that moderate intensity exercise does not affect your milk supply. I definitely did think, at that time, I was definitely worried that if I exercise because I'm sweating, I'm losing fluids, it'll affect my milk supply. But actually it does not, okay? The only thing is that if you exercise strenuously, okay, it may increase the lactic acid in the breast milk, and the baby may think that, oh, it tastes funny, and they may be fussy after feeding. But again, it has shown to have no effect on the milk supply or baby's growth, okay? All right. Now, when you're exercising, you also might want to consider wearing a nursing bra and or a nursing pad, because sometimes when you exercise, right, there may be a letdown, okay? Also, because nursing bras sometimes may be the most comfortable bra that you can find at that time to exercise, then go for it. So in general, let comfort be your guide. In the past, maybe you can wear a sports bra comfortably, but now that your breasts are a lot bigger, and then you have all this, like, maybe your boobs are leaking, the tightness of the bra may not be ideal. And also you don't want a bra that has like an underwiring underneath. Too much pressure over your breast can lead to things like blocked ducts or things like mastitis, okay? Now, one great trick would be to pump or to latch before you exercise, okay? That way I felt like it was just the best idea, like just do that and then exercise, okay? Now, we all know that physical activity and exercise is important. And as a physiotherapist, I definitely know that, but sometimes I have to be honest, I don't do it, okay? And the reason being is that we feel tired. Like, being a mom is extremely tiring, and there's so many things that you need to adjust to. But I want you all to think about some of the barriers that, I know you do want to exercise, let's make this assumption here, but I want you to think about what are some of the excuses and the reasons that you keep telling yourself, and that is the reason why you don't want to exercise. If you can identify them, and then only when you can identify them, then you can think about solutions about how to like alleviate that level of stress, right? So that you can exercise. So the top three things for me are that I feel tired because baby's been waking up all day, all night, okay? And then I don't have time because like baby's crying, I need to poop, I need to pee, I need to do so many things, I need to do the laundry, okay? And then the third thing would be like, you don't feel good, right? You just feel very tired, and that you may have some aches and pains here and there. So let's say for the first one, if you feel tired, you should get support from your partner, your family, and or your friends, okay? And then you can, if you have friends who are pregnant together, or if you know anyone from this webinar, you can host like walking clubs, you can exercise together, okay? And always with exercise, this is not so much about like shaming or what, but just set manageable and achievable goals, things that are relatable to you, so you feel that it's important. Also try to inject some fun and make it enjoyable for yourself. If you think that you need like a coach or someone to like nag at you, sometimes I need that, okay? So you can join pregnancy-specific classes, right? You just need to pay a bit of money, but sometimes paying the money, you would go for the class, all right? But in general, consider like some social components to your exercise. Previously, I mentioned some social component to your exercise so that other people can encourage you and you won't feel so isolated being a new mom. All right, so when we talk about pregnancy-related discomfort, if any of you continue to experience aches and pains and severe aches and pains afterwards, I think it's best not to keep it to yourself, okay? Always make sure that you tell the doctor that you're not feeling good, and then you can see someone to get some help, okay? All right. The next thing that I wanted to talk about is your pelvic floor. So I can't see your faces, so I wouldn't know if anyone knows about this, but your pelvic floor is an important part of your core, okay? And this is the muscle that can sometimes be injured, you know, when you give birth, okay? And even when you even if you've had a cesarean section, the fact that you carried the baby for 9 months, it does stretch the muscle out quite a bit. So therefore, people who have been pregnant before, you know, you may know that, you know, during pregnancy, you may experience new things like, oh, why am I leaking, you know? So the pelvic floor muscle is essentially like a sling or a trampoline. If you look at my photo and picture in front, it's the pink red sheet of muscle. And what it does is to keep it really simple, stupid, number one, it supports the weight of the pelvic organs, for example, your bladder, your uterus, as well as the large intestines or the bowels, okay? And then the second thing is because each individual pelvic organ has its own passage through the pelvic floor muscle into the open. And so therefore the pelvic floor muscle surrounds these little passages. So the second function and what it does is that when it tightens, it therefore controls your ability to urinate, pass motion, okay, and is also involved in sexual function. Okay, if you have any issues with your pelvic floor muscles, you may have things such as incontinence or leaking of urine or stool, or what we call prolapse, where the internal organs actually descend down into the vaginal canal and can cause quite a bit of discomfort. Okay, so if you're pregnant right now or if you've delivered, you can actually start to practice. So now that you've understood where the muscle might be, okay, you need to be able to try and feel it. So what I want to do is for everyone to try and tighten your back passage, the muscles around your vagina, as well as your front. And think about as if you want to stop yourself from passing urine, okay, or stop yourself from passing gas. So it's like a very tiny movement. You know, your body's not supposed to move. The person next to you shouldn't even be knowing that you're exercising, okay? And you think about it as if like an electricity is just coming together in the middle. And or if you're sitting like me now, you can think about lifting a really wet tissue. So you're drawing in and up towards you and lifting up towards your head, okay? So some of you may or may not have that feeling, okay? But like I said, if you're interested, you can always ask a physiotherapist to teach you one-on-one. Okay, now once you've done it and you kind of think like, yeah, I think I got it. And some of you may feel more movement in the back passage, that's fine as well, or more one area, that's okay. You can actually go ahead and try out this exercise program. So this is a recommendation. So everyone's body is going to be different. You may be only able to tighten your pelvic floor for X amount of seconds. Then this is where you start. And then you can release for X amount of seconds. So you essentially, the bottom line is feel the tightening as well as feel for the full relaxation, okay? And then you can repeat it 10 times per set, 3 times per day. Okay, so some common pitfalls that we know of after teaching for quite some time, okay? Try not to practice this when you're urinating. So by right, when you're toileting, your pelvic floor should open and allow you to empty everything inside, right? So if you're exercising while you're going to the toilet, it may cause things like urinary retention and you may not be able to empty your bowels completely, okay? Now, as you practice, right, you want your whole body to be relaxed, okay? Keep your tummy, your bum, and your inner thigh nice and relaxed, okay? The star of the show should be your lady parts. It should be the only thing that is tightening, okay? Now, the third thing and the most important thing is we don't want you to hold your breath. You may have gone for classes or you may have looked it up on YouTube, but you know, if you try it yourself, naturally, some people will want to take a deep breath in and then tighten their pelvic floor. So try not to hold your breath and bear down because that creates a lot of pressure in your belly and that can push down onto the pelvic floor and it'll be harder to actually activate the muscle. Okay, all right, if you have any issues with that, you can actually put your hands on your chest and your belly just to make sure that all of this is nice and quiet, okay? All right, I wanted to just give a bit of a demonstration on some of the exercises. I'm back. So I'm going to try and do the exercises because funny story is I came in today, I was working today, and I was doing something with a patient and boom, I start feeling pain here. And I'm actually like expecting, and so this is my second kid, and as a physio, I know that this is pregnancy related pains. And it's funny that I'm trying to show you exercises right now with this, like pain here, but I think I'm feeling okay. And I just apologize if I can't go the full number of repetitions, okay? So the first part of the exercise, if you can, so if you're sitting on a rolly chair, I think you should find a chair without wheels just for safety, because I don't want any of you to fall off the chair, okay? But I wanted to talk about your posture and then just go through some strengthening exercises. So, you know, when you're pregnant, your body goes through postural changes, right? As your belly gets bigger, it is becoming harder to carry yourself. And then when we did like a soft survey about what pregnant women, postpartum women who have delivered want to know, they actually want to know a lot about postural awareness. So I thought, okay, maybe there's something going on with that and I should really talk about it, even though it doesn't mean that if you have good posture, you won't get pain. But I think having bad posture can definitely make it worse, okay? So everyone, I want you to sit up tall, okay? Keep your shoulders nice and relaxed. And I want you to think about just looking straight ahead and as if a string is pulling on the top of your head, something lifting up in your chest, lifting up. Okay, and you can do shoulder rolls just to open up your chest, because maybe you've been doing this all day in breastfeeding, maybe. Okay, so you can do shoulder rolls 10 times backwards. 3, 4, 5, 6, 7, 8, 9, 10. Okay, if you have a working from home situation and you find that you have a lot of tension here, you can also do that to remind your body that this is the right way to sit, okay? Now, the other one is called scapular retraction, is to also kind of relax the front of your chest and to strengthen the back of your chest, because a lot of us are doing this most of the time without even knowing it. So you want to make a W like this, okay? So your W should be like flat, right? It shouldn't be like your hands are in front. So just a W like that. And I want you to engage your shoulders and the back just ever so slightly. So you don't want it to be too high. Okay, you want it to come down, okay? Now, the next thing that you're gonna do is you can think about squeezing your shoulder blades together. Okay, so you won't see, I'll show you my shoulder blades, but you can then tuck your elbows back and relax, okay? All right, so what it looks like behind, it's a very small movement. So you're gonna move back and front, back and relax. Squeeze the very thin pencil behind, in between your shoulder blades. Okay, try not to squeeze like this. Keep it nice and low, keep it nice and tucked down. Tighten and relax. Okay, let's do another 5, 4, 3, 2, 1. Okay, all right, you can put your hands down. So these are just some exercises for your upper body, especially for a lot of us who work on the computer. We tend to really become like a little turtle when we're working. So this is just another way for exercises to reinforce good posture. Now, the final thing that I wanted to talk about is pelvic tilts. So pelvic tilts is a way for you to breathe movement into the low back area. Okay, so what you want to do is you can sit up nice and tall, okay? And if I put your hands around your hips, so what you want to imagine is that you're holding onto the rim of a pail full of water. And then as you tip the pail forward, so if your fingers go down, your thumbs move up, okay, you're spilling the water forward, you're arching your back, right? Okay, so this is tilting forwards. And then if you bring your thumbs down, back, and then fingers up, you're tilting the rim of the pail backwards and you're spilling the water backwards. So you have that imagery in your mind. Okay, then I want you to tilt your pelvis forward and backward and forward and backward. So for those of you who have back pain, you know, or if you have a big tummy right now and you're essentially like hanging out in this position where you're arching your back quite a bit, you feel the strain here. I do it too when I'm pregnant. I just really like to hang out like that because it's just easier. Okay, so you can tilt your pelvic forwards and backwards. And what you should notice is that as you flatten your back, as you tilt the rim backwards, you feel like, hey, I'm actually engaging a little bit of my tummy muscles, my core, but my belly button is like going in a little bit. Okay, so let's do it 10 times. Let's tilt forward and back and forward and back. So just this area. Okay, try not to lean forward like this. All right, as best as you can. Okay, all right. Okay, let's do another 5, 4, 3, 2, and 1. All right. Okay, so to find the neutral spine, you can do this pelvic tilt. You can move forwards and backwards and then just find the middle spot where your spine is sort of like most comfortable. So that will be like your neutral spine because you don't want it to be like in the extremes of position. So once you register that this is your optimal posture, okay? All right. The other thing that the next thing that I want to go through is just 3 quick chair type exercises would be chair dips. So my chair doesn't have arms, but if your chair has arms, maybe you can just watch me. So these are to strengthen your tricep muscles. So you can just you can just scoot your bum off, okay? And then all you do is just bend your elbows and straighten and bend and straighten. Try not to lock out your elbows, okay? All right. And if you feel like it's getting really hard, like you cannot really support your weight, you can just press down with your foot, okay, and help control the difficulty of the exercises, okay? All right, the next one is a squat. So you want to sit up straight, nice and tall, sit with feet shoulder width apart, okay? And you can do it like me, you can put your hands in front of your chest, and then what you want to do is just simply stand, okay? And then you can sit, okay? Now you try not to bring your feet, your knees over your toes. So there's like an imaginary line, and then you just get up, okay? And then when you sit down, you stick your bum out, you can touch the chair, and then you can get straight. Stand up straight. 2, and up. 3, 4, 6. If you feel tired, you can sit even. 7. That's what I like about chair exercises. 8, 9, 10. Now, for some of you, you may feel like you're actually arching your back quite a bit. So even before you go ahead and do your squats, you can think about just engaging your core slightly, just tucking your tummy in just ever so slightly before you do a squat, and you may find that you should feel a little bit more stable. Okay, the lunges, I'm going to try my best. I think I'm going to do it only on one leg. So normally when you do a lunge, it's a little bit challenging because there's nothing underneath, but you can put a chair here. So what I'm doing now is my right leg is in front, my left leg is behind, okay? And let's say if I stand up straight, it's like a triangle, right? And then you can put your hands on your hips, look straight. And as I go down, I'm sitting onto the chair and then standing up, straight up, okay? So you won't feel like you don't have anyone helping you. Like here, it feels a little bit harder. But at least with the chair, you get this feedback like, okay, not too low, and then come back up. 2, and up. 3. So make sure that your knees are, again, not going over your toes, and you're sitting straight down. You don't want to be sitting in an angle this way. Okay, and the back of, so it's a big step backwards. All right. Again, engage your tummy, but I'm gonna do just 5. So 1 and 2, 3 and 4, and then last one. Okay, I'm not gonna do on the left side because I'm having a little bit of pain, but it's just the repeat thing on the other side. Okay, so I'm gonna end off with just, with questions, but before we get to that, I just wanted to thank you for this opportunity to speak to all of you, and be kind to yourself, enjoy the pregnancy, enjoy your baby.